Mrs. Beth again, I just wanted to give you guys some guidance on asking questions. We'll let Colleen give us an overview. And then if you have questions to ask, you can either add those into the chat box, or you can unmute yourself using *6 if you're calling in, and be able to verbalize those. We are also recording this and we'll post it later. If there's anything you're uncomfortable asking in a public forum, just reach out to us offline and we'll make sure that we get you your answers. Thanks.
Great, thank you so much, Beth, and thank you so much for everyone who is joining us this morning. I just want to start off and once again saying thank you, even though I know I already said it, but I can't thank our business community enough in the sense of holding tight while we've been kind of working through, this pandemic, which is still occurring, which will continue to occur into the next couple of months, if not next year. The big pieces of that are obviously once there is a treatment and or the vaccine, that will kind of help loosen up some of the pieces that we were at. The thing to keep in mind is that we truly are at a new normal. And that means all of the social distancing pieces, remaining 6 feet apart, washing your hands, screening, and wearing a face covering. And so with the screening piece, that means that, obviously some of you have already submitted your social distancing protocol. You've seen some of the signage and some of the requirements in the sense of having the ability to symptom check your staff and or employees. And that includes even the public coming in, signage should be, hey, if you're sick, please do not come in. And so those truly are the 4, and obviously the face covering is the last one. And we can talk more about that specifically in just a little bit. What we are looking to do is, our current public health order goes out until the end of this month, May 31st. We are looking to amend our public health order so that on June 1st, we have the ability to open restaurants. This does not include bars. Bars are not included in this piece. I do have a document if folks are interested that I can share my screen in a bit if folks want to see kind of where that comes from as far as the risk categories. So everything that we're doing currently is we are working on, evidence-based strategies. We are looking at all the data that's happening locally as well as across the state. And we want to be really mindful that we continue to open slowly in a controlled manner, and that as businesses, we're kind of setting the tone of how we want our community to interact with us and our visitors and vice versa. I think the more that we can be united on, those 4 social distancing principles, including the face covering, which I know has come up. We have signage that we can share with everyone if that feels like a good fit for folks. Obviously, there's already some signage that needs to be posted, but we can assist with that in both English and Spanish. I think the more comfortable we all are in requesting those 4 main pieces, that social distancing, screening / don't come in if you're sick, face covering, and good hand hygiene, washing your hands, hand sanitizer, that kind of things, the better we are, I think, as our community interacts with us as a business, as well as even what we're doing, as a county, and everyone understands that this is the new normal and this is the new expectation. I think the better it is for all of us versus, hey, I don't agree with this piece, and I don't think we'll do it. That just isn't helpful for us as a community, because we know that everything we're asking done is truly evidence-based and showing how we can decrease the spread. COVID-19 is here for us for, like I said, and, into the next year. And if anyone's been listening to any of the other presentations, Lisa, so Dr. Zerlinger, right, Dr. Lisa, on Tuesdays at 1 p.m. does present to our BOCC, so our Board of County Commissioners, with all the updated data that we have. And from that piece, we totally recognize that, as a community, we don't have a lot of immunity at this point. And even scientifically, they don't even know what immunity looks like for COVID-19, in the sense of you might have been exposed and you might have what they call antibodies at this point, recognizing that you would have had exposure to it. It doesn't actually mean you may or may not be immune. We don't have that science. So with that being said, we will continue to move slowly. We're hoping to do this come June 1st. Like I said, we are looking to open our lodging and our restaurants, only at this point. Those are going to be the big changes come June 1st. We have different pieces that different businesses have to follow, because there isn't really a one size fits all. We know folks have already submitted both restaurants and some of our lodging have already submitted the social distancing protocol. We totally appreciate that, and we will be working on it. Just so you know, on our end in public health, our goal is to get out those approval letters to you as soon as possible. We're pretty much shifting our whole entire staff into this process for the next 2 weeks, if that's what it takes. But we're hoping to have everybody who has submitted will be receive their approval letters if they actually have everything in place that has to happen. We also want to recognize that you do not have to open if you do not want to open. I think that's a point that each business has to make that decision as well. We recognize all these businesses, you are not able to open your doors 100% like you used to. When we think about those social distancing pieces in restaurants, for example, the recommendation, is that spacing between tables, up to 8 feet in that respect, which obviously means less folks coming through your door, if you will. So it's not exactly business back to normal. We're going to ask lodging to leave rooms that are occupied, and once somebody leaves, we're going to ask our lodging community to leave those rooms vacant for 24 hours to allow all that respiratory, droplets, everything to settle and then go clean at a much higher level than in the past. And we have all of that information. I know so many of you have been educating yourselves, and I appreciate that. So many of you have shared resources as well. And we have looked at those. We've hybrid so many different things from so many different resources to see what really will work in our community. So those are some of the pieces you will see on kind of our intro letter on, what the expectation is. Because hotels, motels, short-term rentals, which we are just looping in as lodging, you're not operating that much differently other than, increased cleaning as well as that 24-hour piece. So the requirement for that piece is truly to look at all the guidelines that you need to follow and sign a form saying that, yes, we will comply to that. We can do those pieces, and that's it. You do not have to submit the social distancing protocol. For those of you who have already done that, thank you. That's an additional step, and we appreciate that. And then for our restaurants, it truly is that social distancing protocol that you need to submit. So that hasn't changed. And so some of you, like I said, have already done that. So thank you for that. And I'm trying to think if there's anything else I want to say before I open up to questions. Like I said, I do have a document that I'm willing to share if folks want to see kind of those risk categories. So basically there is a study and a document that has come out from Johns Hopkins University that has gone out as a guideline / framework for the governors in order to reopen. So this is something that's been shared across the United States. And so, a lot of folks are looking at that, and that's where those categories come from. And the reason why some categories are lower and higher, and you think of some of the things of, everyone who might be on this call and restaurants and hotels, is the amount of time, the amount of contacts that folks have, in these spaces that are closed spaces. And when you think about bars are not able to open because they are considered the highest risk, the highest contact level out of any other group, as you can imagine. So that is why they remain closed at this point in time. We will continue to see what the governor does. We will do our best to kind of align with the governor as much as possible. But please recognize we have the ability to have our public health orders be the same, if not more strict. So we'll cross that bridge when we get there. We do know that he's going to talk about restaurants opening on Monday, May 25th, and we'll see what he has to say. We have looked at the preliminary guidance. There isn't a final guidance right now for the restaurants. That is to come out next week as well. But we were able to crosswalk everything that we have with what the preliminary piece is, with the hope that there won't be major changes for restaurants, at the last minute. If the governor decides that he wants to open restaurants up prior to June 1st, we are not in agreement with that. We want to make sure that we have the opportunity to go through every single person's application prior. And so we are not looking to open up until June 1st. June 1st is our hard line at this point in time. I think that's basically what I have at this point in time. Obviously, we can open up for questions. I do see there's some numbers in the chat box, but if Beth, if you're able to help me with that, I would appreciate that. Thank you.
Thanks, Colleen. Did you want to start with an overview of the business document that gives the links and the guidance for the different business categories?
Yes, do you want to share your screen on that, or should I just talk about it?
Why don't I paste the link and you can share your screen?
Okay, great. Give me 1 second, guys, and I'll get that to you. Give me one more
In,
second. I'll get
in
there.
the chat box if people want to follow along at home.
Sorry, give me 1 more second, please. Because I want to open it in a bigger window, if you will. So it's just going to take me a minute to get there. So thank you. And please know that we've been working very hard and have a lot of folks who had input. So we're thankful that we actually have a document ready and raring to go for you at this point. So there isn't much of a waiting game at this point in time. So let me open it up and I will share my screen. Thank you. All right. Let me do one more thing. The Zoom world that we all live in now, slowly navigating, but getting there. So thank you for your patience as well. Oh, it looks like it, oh, nope, I found it, disregard. Give me 1 more second, sorry. I have so many things up on my screen currently. I believe this is the one. Yes, I did it, great. So can everyone see this? Obviously, like I said, you can follow along at home. So when we started drafting this, I kind of had started with just having some talking points, but I realized that it's really important to kind of reach out to you guys like in a letter format and once again, thanking you. And so as we scroll down on that, let me just move my screen around here. And as we scroll down, once again, we're talking about like the key practices or social distancing, good hand hygiene, wearing a face covering in public, and staying home when sick. I think it's important, and that is one of the asks in all of it, to have the ability to have workers not come to work sick and kind of have those conversations, because there has to be recognition in all of these new guidelines that if you have an employee that is positive, that is an automatic, for restaurants specifically, that is an automatic, we need to close, deep clean, contact trace, see if anyone else has any illness in that circle. And that might increase the time that we need to close businesses. So I think the more that we can avoid that by doing all of these amazing practices, the better off we are. And so in this document, it talks about additional specific and unique guidelines and requirements are in place for different categories of business. As follows: all businesses permitted to reopen under public health order regulations must comply with parameters and be authorized by Lake County Public Health Agency, that's LCPHA, in order to operate. So I'm going to scroll down a little bit more so you can look where we're at. So for general site-based businesses, including retail, government, and nonprofits, so you should recognize that we have asked all of our city, county, as well as our nonprofits to also do the social distancing protocol as well, so that as a county, we are all unified on how we're looking at social distancing in some of the other pieces. So that is the link right there. For retail food establishments, which includes restaurants and cafes, once again, not bars, it is looking at the retail food establishment requirements. So those are all the guidelines that we have put together, like I said, from numerous resources that we feel are what we need to do here in Lake County to keep us as safe as possible, and as well as what we've seen possibly coming down from the state. Once you look at all those requirements, we ask you to then submit your social distancing business application, and that's that link to that protocol piece. If you've already submitted your application, it's just a matter of looking at those requirements to see if there's anything you want to add into your application. If you do, then just email that piece to environmentalhealth@co.lake.co.us. That's the address we've been sharing out for you to have access to all of us, because we're all kind of checking and making sure that we're on top of it. For lodging establishments, like I said, this is a little bit different. They need to review the requirements. So once again, there's guidelines in there for what the expectation is for all our lodging. So that includes hotels and motels and short-term rentals. And once you go through those requirements and feel that you can comply with them, we basically ask for you to say that yes, you are in agreement, yes, you will comply. And then regardless of what application or which one you have filled out, you will receive a letter from Lake County Public Health Agency authorizing you to open on June 1st. And so, like I finished here, we talk about the new normal, which includes all 4 of those practices. We need to recognize that there's another practice, which is changing the culture. We know that a lot of folks, especially from what we see in our community, are either all wearing face coverings and or not. I think it's important that as businesses and our government and everything else that we continue to encourage it. You should know that you can refuse folks from coming into your establishment if they are not going to follow those rules, because recognize that if someone like somebody who's not wearing a face covering, obviously in restaurants, I know that will vary in the sense of, you know, they can have it on, then take it off to eat and all those other things. But I think it's important that we kind of send a message that we are, you know, all doing this, like including having your staff wearing face coverings. We're all protecting each other here so that we can continue to operate and move forward. And obviously, you know, I talked about, you know, we need to model the practices ourselves and educate others on their importance. If you need information around that or feel like, hey, I don't feel comfortable in that, like we can also have just like little education things that you can hand patrons coming in. I think it's important, like I said, that we teach our community as well as our visitors how we want to be interacted with in our community. And like I said, this isn't going away. It's not something that, you know, come September, this is all going away. Like I said, it's so dependent on treatment and vaccinations, which, you know, we know is a long way off at this point in time. Obviously, you want to be optimistic and maybe it'll happen sooner, but we do have to recognize that this is our new normal. So obviously, you know, I appreciate you guys, like, let's work together to ensure that our community remains open and safe. So that is the gist of what we are asking. So basically, you know, if you've already got that link, we know we're sending that out to all of our email as well. So, you know, I will apologize if you receive this multiple times, but we want to ensure that this is getting out and folks understand what they need to do in order to open at this point in time in June 1st. And once again, when I'm talking about opening, you know, obviously we have some businesses open. I'm talking specifically about restaurants, not bars, and our lodging. So short-term rentals, hotels, motels, etc. I can leave this up just for another minute, and then I can take it down and begin answering questions.
And I did want to mention, we do send out at minimum weekly distribution updates to anyone on the mailing list. If you're not already on that email list and would like to be, please email lakecountypio@gmail.com and we will make sure that you get added. We should have the next blast going out tomorrow, and that'll include the links and guidance on the business documents as well as the general updates on COVID-19 recovery and response efforts. All right, Colleen, are you ready for some questions?
I am, yes. I don't have the ability to follow chat, so I'm just going to try to stay focused and hear what you have to say and
Great.
Go from there. So thank you. And I might take notes just in case there's some added pieces. So thanks.
So it looks like the first question is clarification on closure or restrictions on bars. What if this is an outside bar? Are they still closed?
At this point in time, yes. We might have an opportunity to revisit that, but because of the social distancing piece not necessarily being able, and I recognize that we could go back and forth on like, well, if they do this and if they do that, which I'm not willing to have that conversation right now, but we can talk separately offline about what some of those expectations are. But at this point in time, we are not making a distinction between inside and outside bars. So thank you.
Next question, if there's a barrier in between your booths, would they still need to be 8 feet apart, and would bar stools need to be 8 feet apart? So I'm assuming that's sort of describing those partitions that you often see between booths in a restaurant where they're kind of back to back.
No, I think that's a great question, and I don't know if Jackie Littlepage has the ability to answer that one because I haven't. As you know, I am not the subject matter expert on restaurants. I rely on others for that. Jackie, have you seen any guidance around partitions at all, or what it might say? Because I don't know that piece.
I have not seen anything specific to partitions yet. The guidance document that was a draft from the state's office did specify 8 feet, with the notions that that was a draft document and it could change between now and Monday the 25th. So as soon as we learn more about this partitioning, we will certainly take that into account. One thing that we have heard from multiple states and other counties is some, the ventilation is one of the big things in the restaurants. We want to encourage open doors and open windows as much as possible, and putting up partitions, while yes, it can prevent spittle or exhaling from going from booth to booth. Sometimes it can also impede the ventilation throughout the facility. So that is something that is still being looked at the state, and we are also looking for that guidance. So as soon as we know more, we will certainly let you know.
Yes, and so if that's something specific, you can, send that information to environmental health if it's not already in your social distancing protocol. Like, please feel free to add in some of those pieces. And like I said, we will work with each one of you, figure out what we can or can't do as best as possible.
Thanks. So next question is, how can the Main Street and City help to promote that downtown is reopening starting June 1st, but also in a safe way regarding the public health orders?
I think that goes back to really, kind of branding, right? We have our Lake County Safer at Home. We talk about, those 4 principles on the side that I think if we have the ability to message, folks to say, hey, please come in, but do it safely. We follow social distancing. We want people wearing face coverings. We want good hand hygiene. We don't want you here if you're sick, kind of a piece. So I am not the PR wording kind of person, but I think if we have that ability to message and, and welcome folks, because I think that is what, is going to happen. Obviously, we know tourists have been moving in and around, and visitors, and that kind of speaks to my piece of, if we can set that now and we all are unified in that I think that is a great way to move forward.
Colleen, this is Sarah Dallas. I put that question out there. To follow up with that then, I mean, that's a lot of messaging that probably wouldn't be able to go on the banners. But I guess what I'm asking is, if we created a united marketing pitch of banners that we're open for business safely, and then subsequently supported that message online through social media, through the print media, of how those protocols work, and expect also that businesses are doing their due diligence through your protocols and allowing them to be open under those new standards, would that be something the public health would be comfortable with?
Yeah, I definitely think that's I would be comfortable with that. And obviously, we intentionally, if you saw, the letterhead that we've been using, we just say Lake County Safer at Home. We could take out, obviously, on some of the ones that I specifically push out, we have Lake County Public Health's address on that. But if that's a template we want to, use, I think, the more we use one piece and everyone recognizes that. And I think it's a really positive message and not a negative thing at all. And hey, yes, please come and let's be safe. And I think it also allows folks to recognize that we care about everyone, not just ourselves, but them as well, at being safe in our community, right? The last thing we want is for, something to happen where someone, may or may not, but feels that they, have gotten infected in our community, and that just doesn't bode well for us versus we've done everything right. And we're all in it and doing it well together. I don't know if that makes sense, Sarah. Sorry.
Yeah, thank you. And one other thing I wanted to just put out there and follow up with, so we are going to be launching our construction business meetings to support the businesses and set expectations every Thursday at 10:30. The first one's tomorrow. But in that, we have a double whammy here. We have the construction project that's lasting the entire summer. The mill overlay component of it is not happening until late September, early October, which means all the work that we're seeing with them doing the ADA and cutting sidewalks and being out there is going to take place from now all the way until the end of September. They're saying they're not really ahead of schedule. They think that they're right on schedule right now. So what that kind of presents some issues or problems is, with the doors open, it's louder, and there could be construction debris and things coming in that might not be suitable for our businesses. Also, we're trying to, with the Main Street program, Chad's going to be looking and trying to identify maybe some side streets or pocket areas that might tie into some of the business to open up some additional outdoor seating. Again, working through with CDOT to maybe open up additional seating like al fresco, like we're seeing other communities do, is logistically challenging when it's the CDOT's right of way on top of their construction and project. So I just want to be very transparent that we have multiple layers of complexity to work through, and we are willing to do that, and we want to partner to make that safe under your protocols, also help our businesses have additional strategies, but then also meet the standards and requirements of CDOT with understanding this is construction and challenging.
No, I appreciate you bringing that up, Sarah, and I think that continues to be that there is no right one simple answer or one size fits all because of all of these different challenges that we currently have moving forward.
I wanted to share a resource from the tourism panel. Donna Childress shared that they've been working on some messaging that works to balance both the precautions that we're asking visitors to take, as well as ensuring them that we do welcome them back when the time and conditions are right. And she shared the link there at leadvilletwinlakes.com/resources that also speaks to the Restart and Recovery Plan by the tourism panel, that includes some reopening messages that could be borrowed and adapted for local businesses in terms of your own sort of individual messaging. So thanks for putting that out there, Donna. Next question, will there be a maximum number of people that can be seated at one table?
Yeah, no, that's a great question. I think we were waffling between 6 is the current recommendation, but we recognize that some of our families may not be able to just fit at one table of 6. I know we talked about 10, and I'm going to actually have Jackie jump in to see where we landed on that.
I am so sorry. Can you please repeat the question?
Absolutely, Jackie. I know we had a large discussion around max at a table. Did we land on 6 or did we land on 10 at the end? I'm
going to have to defer to Rebecca Bear. Becca, are you on? What did that final guidance say?
Hi, the final guidance says 6 to reflect what we're seeing from the state currently, which could be subject to change.
Thanks, Becca. I appreciate that. And so as you can imagine, there's been lots of fingers and lots of hands working on all these guidelines. And, I will apologize ahead of time that I did not have the final say, as I am not the subject matter expert. I rely on, specifically Becca, to help us with that, who did crosswalk all the resources we had, including the state. So if the state's at 6, we stay there in the sense of, right, we don't want to come back and pull back. So thank you so much for that, Becca. Great question.
Next question is, do you anticipate that guidelines and restrictions will differ for indoor versus outdoor events and or private versus public events in the future?
Yeah, I think we're working towards that. I think, the big push right now is to, get some of these businesses open and then give us some time to really think about some of those outside spaces, because we do recognize, right, when we think about some of the recreational pieces, if you are, that are opening and will be opening, so much of the the evidence is pointing to, outside is a much better way to interact than inside. So we will have conversation around that. At this point in time, we haven't made any decisions, but please know that it's totally on our agenda. We recognize that we do have some event venues that are looking for some of that guidance. So we will definitely be working on that, and obviously reaching out to other communities and see where they're at with that as well.
Are restaurants or owners responsible for policing or maintaining social distancing on patio areas? For instance, if we have all of the protocols and the spacing in place, but people are not following them or are pulling tables together?
Yeah, no, I think this is your responsibility and I don't like the word policing. I think it's about education, right? In the sense of, hey, please, we're asking you not to do this. This is important. This is why. And if you don't understand those pieces, please let me know, and we can have, like I said, a little handout. Because because of, all those actions, the more that we continue it to gather, in larger groups, the more susceptible we are in the sense of, passing and spreading, COVID-19. And so, and, a piece of that, right, we recognize that at this point in time, I believe it's just under 50% of folks that are exposed to COVID-19 will never show symptoms, will never know that they have it. And so I think we have to be strong that way. And I think of all our spaces, when I think of some of the spaces, because I love all of our restaurants in town and I've been to all of the places, like there's not much room. If you start pulling tables together, then you have to figure out that 8 feet from the next table. And if you just shrunk that space, then you have to like not have people sitting. And so I think it's better to, and maybe sign on the tables, like please leave tables in place, something along those lines. I think the more prepared you are for all of those situations and kind of, I think it's important to like work through those scenarios with your staff so everyone feels comfortable that yes, you will be supported. If you tell folks they can't do that, like recognize that it is, 6 at a table and no more than that at this point in time.
Are we being asked to enforce these rules with the general public and to deny entry or service to customers who do not comply?
You should know that you have the ability. So part of your license is following the requirements that we are setting forward. And this is not like in any way, shape or form of like, hey, we're gonna, threaten you if, your license, if someone inside your establishment is not complying. But I think it's important to have, that person at the front door being like, hey, because part of the signage is you need to have face coverings. And like I said, we do have some, in English and Spanish that we can, share. And I think that's where we need to get to. And so once again, obviously I don't want to put anyone in a compromising position, but recognize that you are compromising, your staff and the other folks, the public in there. And if we do come down with cases and it gets linked, those, pieces, then, there are requirements to close businesses in order to do proper cleaning and giving us time for social distancing and making sure we're not missing anyone. So to me, the more unified we can be and teaching our community and our visitors how we want to be interacted with, the better off we're going to be.
And then the flip side of that is we've already seen that these rules can be perceived as contentious and confrontational. People are already breaking them, and enforcement is a tough ask when business owners have gone months without pay and need every single sale. And they've also seen other, states and areas have incidents of violence around enforcement. So while you've, made it clear that that's, optional, I think that there's concern on the other side as well.
No, I absolutely can appreciate that. Like I said, my expectation isn't that you're not going to let folks in. Maybe there's opportunity to have some face coverings, with your logo on to be like, hey, this is what we're asking folks to do. I think it's going to be challenging for all of us, but like I said, the more that we can feel comfortable having that conversation, even if someone refuses, the fact that you're willing to have that conversation and say, hey, do you recognize that that is to protect, me and my staff and, everyone else at this table, kind of a piece so that we can remain open. I mean, I think you have to recognize that piece too of, if folks are just infecting everyone in your, in your space, then all of our businesses are going backwards and we're going to have to close. And that is not what I want. So that is my point, is if we can really push those 4, elements of the social distancing and, really have our community and engage them in a really, positive manner, I think the better off we are.
There's a comment regarding desire for some flyers that can be shared that have a unified message around, safely visiting and interacting with Lake County. And did just want to say that that's something we are currently working on between public health, tourism panel, city, and other partners, and should have those materials finalized here over the coming weeks so that those can be available and distributed by businesses and other, tourist-focused organizations by the end of next week. So we can, again, sort of approach it with that education and positive approach versus the sort of punitive enforcement piece. So just wanted to acknowledge that that is in the works. Becca did share also that if there is discomfort with a patron and their inability or lack of desire to comply with the social distancing and safety precautions, that a restaurant could certainly offer them, takeout or pickup versus dine-in if that were a consideration. Next question. Knowing that some attractions are opening this weekend and that the governor's guidelines on avoiding more than 10 miles of travel are still in place, but we also recognize that traffic in our areas seem to be picking up anyway, how do you feel about the tourism panel publicly how do you feel about the tourism panel publicly listing opening attractions for this weekend? Should we or should we not?
I would say no, in the sense that, you know, folks are going to come through town and see what they need to do. I don't want to openly advertise that, you know, that we want folks here. I think, you know, our messaging will be a little bit more gentle. And I don't feel like we've been that harsh overall in the sense of recognizing and even working with businesses that, you know, do have tourists. I don't want to get ahead of ourselves in the scheme of it all. Like, because of those attractions, and I'm not too sure which ones you're talking about, in the sense of there might be some that are planning on opening that have already gotten approval for us, then I think, you know, it's important to note that they are severely limited about how many folks that they can have in their facilities / attraction. So I don't know that we need an increase in volume in that respect.
What is the difference between a cafe and a bar?
Becca, do you think you can feel that one?
Yes, so bars are to be, so an establishment that is exclusively a bar is still closed, and bars within restaurants and cafes are closed if there is preparation of drinks or food happening behind the bar, because someone sitting there could not maintain distance from the employee behind the bar preparing drinks.
And I believe the clarification then is around, you know, bars being those establishments that don't have a primary food menu, that they are predominantly or exclusively alcohol. Is that correct?
That's correct.
Do we as a county have virus contact information on the patients who have tested positive in our county?
So yes, we are aware of everyone who has tested positive, and we have contact traced and reached out to anyone that might have been considered a close contact. And, you know, we've done quarantine and isolation on everyone to date at this point in time. It should be important to recognize that a lot of our positives that we're getting currently are the antibody tests, so there is no current infection. It just shows that they were exposed. We are able to call them positive if we can link them to someone who was infectious, or excuse me, had like a known infection where they did the PCR test, the nasal swab. So from my last notes that I have, we have not had someone who has been actually, who has an active illness since the end of April. So like April 30th, May 1st, if you will. So we're doing well. Our social distancing, we should recognize that our social distancing has gone really well, hence why we're in this spot. We also have to recognize as we begin to open, and like I talked about cracking the door, we're opening it for a little bit more, is we will not know the results of what happened on June 1st, or at least, you know, 3 to 4 weeks after, in the sense of, we know incubation period is 14 days. Typically it's 5 is when folks start to show symptoms, but then people have to be, you know, sick enough to come in and get tested. Please know that anyone who has symptoms and is symptomatic, free testing is available for everyone, regardless, anyone, everyone. So that is how we get more data. So if folks are feeling that they have those symptoms, that's really helpful for us, so that we can kind of clamp down on, you know, a possible cluster, if you will, versus it just keeps spreading without us recognizing that because someone hadn't been tested. We have information on all of those positives at this point in time. Sorry, that was a little long-winded, but hopefully I kind of answered all the pieces.
I'm really confused on how we are going to have to require people to wear a face covering in restaurants while they're eating. Will this apply to patio seating? And can you tell me how you eat with a face covering on?
So I'm just going to put it out there. Let's use some common sense, people. Obviously, you cannot eat with a face covering on. With that being said, it's very important that prior to them, you know, eating and or receiving drinks, and I love our community and we operate on mountain time. You are not turning tables in 15 minutes flat. There's a lot of time that to get, you know, your meals right and everything else, if you're sitting at a table not eating. So let's just recognize that and be mindful of those pieces.
Are we still allowed to sell alcohol to go?
Yes, that has not changed.
If we haven't had an active positive case since the end of April, why can't we get a variance to open early?
Because of the fact that the information we're getting is all the social distancing. We only loosened up our social distancing on May 1st. So we're still looking at the data that is coming in, and we're only, you know, almost 3 weeks into it. So that is why. So for each of these phases, it takes a couple of weeks to get the data. And people were really good about stay at home. people have not been so great about safer at home kind of adhering, and even knowing that people are traveling through our community. So it takes a couple of weeks to get that information. And so that is where we're at. And a variance is not what we're looking to do at the same time. So June 1st.
I've also heard at the state level that the turnaround time for variance applications is at this point 2+ weeks. So I'm not sure that at this point you'd actually be ahead of the planned time frame anyway.
That is accurate as well, Beth. But I think it is important to note that, you know, we want to make sure we do this well, and we don't jump the gun.
So Chaffey County is behaving very differently from this messaging. We are not an island, so how can this work?
No, I think that's great. You should recognize that, you know, we're in contact pretty consistently with Chaffey County, and a lot of what is happening in Chaffey County is actually not condoned at this point in time. A lot of folks are going outside the parameters. They have sought some variances. They have not come through yet. They've not been approved. So anything that's been happening outside the public health order has been through folks just making their own decisions and not following public health orders.
Can you talk about the procedures and policies for food trucks and food carts going forward?
Yeah, Becca, would you like to do that?
Yeah, so the procedures don't directly address food trucks and food carts, but everything should still be applied to them. For example, if they put tables outside, they would still need to be spaced 8 feet apart, placing markings on the ground for people to stand on 6 feet apart who are waiting in line. So all of that would apply depending on the unique situation of the food cart or truck, as some have tables outside, some don't, and whatnot. So we can work together one-on-one to fit the guidance. Or, well, in the social distancing application, it will allow you to write about how you'll fit the guidance for your operation.
That's the last of the questions that are in the chat box. Is there anyone who, oh wait, just got a new one. I'm just reinforcing, we also need public officials to come and see what's happening on the ground level. You know, please visit the businesses in person. It's been difficult because customers are not complying and staff is having difficulty getting on board. Cash flow is becoming a crisis situation. And there's just you know, urgency around needing to be able to operate businesses. Sorry, Colleen, I think you're muted.
I think you muted me. It said the host muted me. Were you afraid what I was going to say? No, just kidding. No, I totally, please know that I absolutely recognize the challenges, and I know I'm asking a lot and trying to normalize these pieces and everything else. But you know, the reason that is if we start to see an increase in infections, and we're having, you know, more folks, and we're looking at what we can do in our healthcare system, or we're seeing what's happening in other counties, like, we're gonna have to go backwards. I want to make sure that we go forward slowly. And you know, in the end, I'm just going to ask you to do your best. But I think it's important that you have your employees. They need to be wearing face coverings in order to interact with the public. I think that is a deal breaker. And please know, we plan on, you know, after June 1st, we plan on kind of walking around and making sure you have what you need. We do have resources like signage and things. So if there's anything that you think that, like, hey, you know, in both English and Spanish, because that is one of the requirements. We know that we have a lot of our community that accesses our businesses as well, and it'd be helpful if they understand, if everyone can understand in the language of their heart what those expectations are. And so I really, really do get it. And like I said, we're going to do our best. And in the end, like, we're just trying to, you know, keep the spread at what it's at, and not having, you know, a huge spike that then it makes us go backwards. So I just want folks to recognize, you know, that we're all, you know, in this together. I mean, really are. And you know, if it's happening in one business, you know, it's affecting all of us. So I think that's part of the conversation as well, for businesses to, you know, lean on each other. And I know that's what's happening, you know, in the public health world, in the sense of, you know, so much of what we're seeing is people not in compliance, and people just, you know, making decisions. And I have to say that I so appreciate everything that's happening in Lake County, because I feel like all of you guys have been communicating with us, asking great questions, and just not going for it. And I totally appreciate that. And I understand being held back and what that looks like. So thank you.
Do we have to give disposable menus to each customer? That might also be an opportunity to speak to management of those high touch surfaces and items.
Yeah, I'll let Becca jump in on that one.
So disposable menus are encouraged but optional. You also have the option to disinfect menus after each use.
So a comment regarding, again, just the contrast between Chaffey County and Lake. So we'd like to understand how we're supposed to be good neighbors while Chaffey is bringing money back in and we are becoming a ghost town.
I don't know what that refers to, because at this point in time, their restaurants are not, open. It looks like someone is sharing that there's some outside seating pieces, but it's very limited in that respect. And so I still feel very strongly about what we're doing and how we're going about it. And so I appreciate your cooperation.
Janine is encouraging folks to participate in the recovery team meeting tomorrow, Thursday at 3:30 p.m. There'll be discussion around economic recovery, and that would be an opportunity to share your needs, your reality, and be able to inform the focus of the recovery team to help address that. Chaffey County is opening lodging on Monday, May 18th. Why are we opening 2 weeks later?
We have a lot less resources than Chaffey County does as far as healthcare and access. And so we are being very mindful about how we're opening. And so June 1st is when we are looking to open. And when you think about that, we are thankful that we're seeing what's happening in other communities, but we can't necessarily compare ourselves to other communities because we all have different capacities. And that's a big piece of the equation.
Janine with Department of Human Services also wanted to share the resource for individual financial assistance. Calling the Human Services Department, you can reach out to Janine at janine.mcgee@state.co.us. Her email address is in the chat box.
Yeah, I think that's important. I think this is a time where there is a lot of recovery programs. That is not my expertise either. I'm not the subject matter expert, but I think the more involved in understanding about how that might benefit your business, the better. But like I said, I'm not the subject matter expert, but I know there's a lot more opportunity right now than there ever has been, and it may not be here, come September. So if there's any opportunity for folks to utilize any of those programs, participate in that recovery piece, share your knowledge, see where folks are at. And, we have had a lot of folks in dire straits, as you can imagine, and that there's an opportunity to assist in other ways, even if it's just paying a rent or some other pieces that frees up, funding for other, pieces in folks' lives. I think that's important to recognize that, this wouldn't be something that someone would, ever think of asking or feeling like, oh, I don't really need it. But if this is an opportunity to free up money for other things, then look at some of the programs that's happening, through DHS and through some of our other agencies, in our community. And I don't know, maybe I thought I saw, or maybe Sarah, I know that there's been a business piece with the city as far as relief efforts go. And I believe, I don't know enough about it. Like I said, that's not my wheelhouse. I'm not the subject matter expert, but there are opportunities. So Sarah, I don't know, Dallas, if that's something you would just want to touch on for folks to know that they can apply for some other pieces.
So we are open up for basically round 2 of business assistance. I think that's what you're talking about, the business relief grant.
Yes, thank you.
Yes, so there was about $55,000 remaining. That is open right now. It closes Monday next week at 5 p.m. The applications and the material are live on the city's website. I'll type it here in the chat group to the link to that information. It will be scored and also time-stamped if they get more applications than they have remaining for funding. City Council adopted up to $200,000 for that assistance program, and it has already helped several of our business owners, you cannot reapply, unfortunately, only if you did not receive assistance the first round.
Thank you so much for sharing, Sarah.
This is Commissioner Mudge. I just want to add on to Colleen's comments about reaching out to Human Services and, the city, EDC, chamber, and kind of reiterate some of the feedback that we got on the business survey that went out. And, according to that, 50% of business owners hadn't even attempted to reach out and take advantage of federal, state, or local funding. And again, reach out to the Small Business Development Corp through the EDC and reach out to Human Services, because individually you are eligible as a sole proprietor. And, the only, in a lot of cases, 24% approximately of business owners locally are their only employee. So you're eligible for unemployment and the maximum benefits through this event and under the CARES Act through the COVID event. So please, again, reach out and find what opportunities you can, though I know not everybody would be eligible for everything, but please reach out and try to learn more. There's a lot of information going out with the city from the city clerk on Fridays, and while they're extremely long emails, it would definitely behoove you to sift through all that material.
So, Colleen, there's a comment here. Perhaps you can speak to a perception that we are being more conservative in our restrictions than the state is, and kind of commentary on Eagle County's variants as well.
Yeah, absolutely. So like I said, we have a limited capacity here for response compared to some of the other counties, including, the Front Range. When you think of all the healthcare facilities, they have the ability to convert. Like Eagle alone has the ability to convert their whole entire hospital space, all their surgery centers, into truly a COVID-19 operating facility. When you think about our hospital, we do not have that ability. We have a limited amount of beds. I think our hospital is doing really well. We have a great surge plan in the sense of if some of the other counties don't have the ability to take some of our critical folks. We currently have a runway that is being, I don't know, I almost said groomed. That is not the right word.
Repaved.
Thank you. I was like, I can't always find my right word. It's currently being repaved. So we've been limited in the sense of we only have the ability to fly out with one company if we have a COVID positive patient who's critical that needs to go to another location. We don't have the ability for any fixed wing at this point in time that can take more than one patient. So we are limited in a lot of our resources, and I think that has to be the recognition for that. And so once again, I ask that you not compare and really figure out. That's what we love, right, about our communities, that we are tough. We get by with what we have, but we don't necessarily have everything that is, available, both in Chaffey County as well as in Eagle County. And yes, we are taking a conservative approach. I don't want to open up everything carte blanche and then have to pull it all back. My goodness, I can't find my words. And so I think that's why we are conservative. And I'm not like, I'm comfortable with that. Absolutely. Because I think, we get one shot to do this well, and one shot at, doing this space reopening. And, we'll see what comes down from the governor. And obviously he has the top folks. He has, some of the smartest people. And if they make other recommendations and we feel comfortable with it, we will follow suit if we feel that that's for our community as well. Like, in the end, we're looking at, so many different pieces of this puzzle, and it's not a flat puzzle. It's a 3D puzzle that we're getting, a little bit of information, and so much of it, like you guys are getting just as much information, as I am. I get more of the data pieces behind the scenes, but it's just important that, yes, that we do this well. So once again, I totally appreciate your patience. I understand what I'm asking. And I just want to thank you again that you've been amazing. Like, I'm so appreciative of all of you. And I don't have that opportunity to tell you each individually, but I'm thankful. And I feel we are modeling some really great behavior in our community that we're being held up to be like, hey, recognize that they're doing a conservative approach, but folks are understanding and we're moving forward. But we're still moving. We're not moving. How's that?
Can I jump in real quick and ask a question? This is Elsa.
Yeah, of course.
I've been trying to ask this question, and I think it just keeps getting mistranslated. So I understand why you all are making the decisions you're making from the health department standpoint. What I'm trying to get at the other surrounding counties issue is, how are we working with those other counties? Because if they are all lifting these restrictions and we are this conservative island, are there ways that the Department of Health has been talking to them to, if they're going to all lift it, consider us? Or would they be willing to take on more of our patients because they are lifting and we don't have the capacity? Just like, tell us a little bit about that conversation, because what we see is everybody else lifting faster than us. And what we don't understand is how we can be separate from those counties, even if we have fewer resources to deal with the fallout. Does that make sense?
Yeah, no, I think so. And I think when, also when I hear that you're saying they're lifting faster, like the only thing that Chafee has done faster than us right now, because they're waiting on their variances, is truly the hotel piece. That is all that they have done. And it sounds like they've done some outside seating with restaurants, but that's really not that different about where we're at. So we're not like so far behind. Eagle, we cannot compare ourselves to Eagle. Eagle has set their own trajectory, their own piece. And I would say that come June 1st, we're in alignment with all of the other counties except Eagle around us. So we might be 2 weeks in this, or not even, we're not even 2 weeks. We're 10 days out or 11 days. But the point is, we do have conversations and we have to be mindful of what's happening in other counties. And so, as you can imagine, just to your point, Elsa, is, I'm on calls with, our regional folks. I'm on calls, with Chafee and, Summit and Eagle. Like I said, Eagle's almost an island to itself. If you want to talk about an island to itself, that's Eagle County currently. And we're not necessarily an island. Like I said, we're in, the same thing. We touch Park, we touch, Chafee. And like I said, Chafee's only got things going and they're waiting for their variances to go through, and they submitted them. And to Beth's point earlier, like they're taking 2 weeks. So I don't necessarily think we're that much different, other than we're just asking to wait till June 1st at this point in time. Does that answer it, or is there more I can elaborate on?
It doesn't sound accurate, just because I listened in on the Chaffee County business town hall yesterday, and their 12 variances they requested, they're hoping to get the response back today or tomorrow. So if they have asked for these 12 variances and they get it, and we're not asking for variances potentially ever, I do feel like we're further behind than just 2 weeks from those neighbors. I don't know anything about Summit County. I'm just trying to look at our 3 influx points, because that's a lot of the people we see are the people coming through to other counties. It's more of just a like, why do we have to do this on our own? And are other counties playing nice, I guess. I'd love to understand that.
Yeah, no, I think I hear you, but yes, so they've asked for some variances, but there's a lot of their and so they asked about restaurants, in that respect. And so hopefully they will hear, but like I said, they submitted, I can't remember if it was the 8th of May, and they're still waiting at this point in time. We hear that they're at the top of the list, but we don't know what that means. And so maybe they're, open 1 week ahead of us as far as restaurants go. But I think, for me, I want to make sure that we have the time and energy. And I don't know that other counties are doing as well as we are, in the sense of taking the time to actually go through applications. We are not rubber stamping anything. I think that's a big piece. And I want to, give a shout out, if you will, to our commissioners and, our mayor. We're not getting pressured. Right now, just to put it out there, they did a survey for public health directors, and over 51% of public health directors have been threatened in this whole entire process. And so once again, I feel that our community, we are doing well. We have, people's jobs have been threatened, like, you sign this variance or you will lose your job. Like, I don't think that's the way we want to roll here in Lake County. And so, and it's not never. Also, like, if I find that, the governor makes an announcement that doesn't seem to be in alignment about what we're trying to do in Lake County, of course I will submit a variance. It just wasn't comfortable to do, which what most counties have, put in for restaurants. And I'm going to tell you, it wasn't the public health directors, feeling comfortable with that. A lot of folks, when some of these variance processes and why they're taking long, like, let's be as transparent as possible. The reason why these variance processes are taking long is a lot of folks did the old cut and paste of some of the bigger county plans, which obviously would not work in Lake County because we'd be small, but the state finally recognized, like, hey, we actually have to have bigger conversations. And so this variance process actually is cause more confusion and a bigger can of worms than for us just to be united, you know, across the state. And like I said, Eagle, you know, is a county unto itself and is an island unto itself and feels, you know, is resource heavy. And so I think kind of, you know, with that being said, you know, it's not that we're so far, if you will, and I will, like Elsa, if I absolutely, or anyone else, if I feel that, hey, that doesn't sit right, and we have that, you know, conversation, you know, with everyone, then, you know, we'll look for variances.
This is Jackie. Can I make Jackie Littlepage, Director of Environmental Health. I work with Colleen pretty much every day for our public health response and recovery efforts going forward. And Colleen, can you speak to the CALFO 5 criteria that the counties need to meet in order to open up further to more than 10 folks, and the testing criterias that, you know, here we've now got the ability to test for the antibodies. It sounds like today we got some new numbers in how many folks have been tested, that kind of the data shows that maybe we have not yet had a big wave of illness in Lake County, and that wave still could be coming. So that's another reason why we are trying to be very cautious in our opening up.
Yeah, no, I appreciate that, Jackie. I feel like a lot of you have seen this already. I just threw it up on you know, the screen for you, but basically a sustained decrease in cases for at least 14 days. And you know, obviously we know that this isn't, we know we're there, right? In the sense of we haven't had any increase in cases. We're kind of in a good spot. Even if we got like 3 cases today, like that were active, like infections, if you will, that doesn't necessarily mean we start the clock back to 0. It's whether or not we can kind of keep going down the way, if you will. So hospitals are safely able to treat patients, not resorting to crisis standards of care. Testing can be performed for all people with symptoms consistent with COVID-19. We talked about that earlier at this point in time. And let's recognize too, testing did not come here for quite a while. We were not priority. We were, you know, knocking on all the doors and we just weren't getting it. Now that we have testing, we're recognizing that only about 3% of our population, you know, has been infected. So you think there's 97% of this population that still has, you know, the opportunity to be infected and or, you know, possibly reinfected, because once again, we don't know what that immunity is. Active monitoring can be accomplished for all COVID-19 cases and their contacts. So currently in public health, we do have the ability to do all of those pieces. We actually have some folks on standby as well that can step in, and we can increase that capacity pretty quickly. So I'm thankful for that. And clear protocol in place that requires social distancing and assists with case identification. As we know, our current norm is living in the social distancing place. So this is the stabilization phase. Right now, we are just at the reopening. We're just in that green circle. And because we are meeting those 5 criteria comfortably at this point in time, and it might take us 4 to 8 weeks to get into that blue square, if you will. And so at this point in time, if you wanted to put a time date or a stamp on it, you know, we started opening up very slowly on May 1st and May 4th. There were some businesses that had opportunity to open up. But let's recognize some of those businesses aren't high contact businesses. They're not places where we have a ton of, you know, folks in there because we have limited, right? We have social distance requirements. So as we start to open up some of these other places where we're going to have more contact, and, you know, we have to be mindful to wait to see what that looks like, to get that data, not to be like, nope, we're opening, only to have to go back. And so as we go down in the green circle, I apologize because you won't be able to see it all the way through on the screen, but maybe I can take it down. Sorry, I'm going to try to track it a little bit so you guys can kind of see where we're at. But basically, you know, when we talk about gathering size, at this point in time, we're still at 10. That's in conjunction with the governor's orders. If we get into that next phase in the next 4 weeks, right, because we're about 4 weeks in, or not even more, yeah, we're about 4 weeks in since we started opening up some businesses. You know, it might take us another 4 weeks before we get to the blue. And at that point in time, we're looking at group size from 25 to 50. And then, you know, 4 to 8 weeks after that is the black, you know, diamond. And for those who ski, probably are recognizing those symbols. For those who don't, they're like, this makes no sense whatsoever. And as you have been educating yourselves and seeing with the governor is looking at this framework. We officially adopted this framework, but is part of the Colorado Association of Local Public Health Officials framework that was taken from multiple resources, which I'm able to share out if you want to do that as well. But like, we have to recognize that if we're doing everything well and we keep rolling, this is the framework that we're working under at this point in time. So that's kind of looking back at those 4 pieces. And so we have to continue to meet and maintain those criteria. And we do know, just anecdotally, like right now, because of Safer at Home, we do know that, you know, cases are rising in both the Denver area, Colorado Springs area. So it's not as if, you know, we flatten the curve very well, but as people start to move around, we're just seeing those effects now. So that, I think that's the hard part of recognizing what we're due today, we will not know the effects of for 2 to 3 weeks later. So I think, you know, that's also a piece of the puzzle.
Thanks, Colleen. On to some next questions. There's observations that we do have guests and visitors coming into town, and a request that we finalize any of those educational materials to distribute as quickly as possible. So just wanted to acknowledge that and you know, ensure that we will do as best as we can to fast track those and get them out to places like the visitor center and businesses who are reopening and serving patrons. Question, do you believe that you will be able to get to all the reopening plans before June 1st? If not, what does that leave the business status? And can they still do to-go or curbside only versus, you know, a broader reopening under the new protocol?
Yeah, absolutely. How you want to open your business is how you want to open your business, and or if you don't want to open your business, like obviously that's your own choice. So I'm not here to you know, have a say in that, but no, we feel confident that we'll get through all the applications. I have reallocated my whole entire staff except 1 nurse. So we, you know, when I think of that in manpower, is like, you know, we're looking to put in, you know, between all of our staff, we're looking to put in, you know, over 200 hours of manpower into the next week to make sure that we have gone through all of those applications. We've already, you know, organized who's doing what. So it's like we already have the process in place of how we're going to kind of work through it and who's responsible for what. So I feel confident that we'll have all of those done by June 1st. And if for some reason we find midweek or something's not going as well as we thought, we will absolutely reach out and let folks know that. Like, it's not like we're going to wait until, you know, Sunday night or, you know, the night before that you can open and be like, oh yeah, we're really behind, versus like, you know, we're definitely going to be tracking that and making sure that everyone knows kind of where they're at. So we appreciate your patience. It's going to take us a couple of days to kind of get into that rhythm. So once again, I can't stress it enough. I appreciate your patience and I appreciate all of you so much. So thank you.
I do think in the documents that were finalized this morning, Environmental Health has committed to responding to applications within no more than 4 business days. So obviously the sooner you get those in, the better, but at most, you know, 4 business days is the duration that you would wait to get an approval.
And actually, I would like to clarify that, Beth, in the sense of it might be 4 days that we're contacted you for all the follow-up. So you may not actually be within 4 days, especially if there's some, you know, nuances and some pieces that we need to work through with folks. But yes, that is our goal. But obviously, it's business days. Recognize that I cannot ask my staff to work over the weekend. As is, we have put in a tremendous amount of time and effort. And for us to still be highly functioning human beings, we need to preserve some time for ourselves. So recognize that work will not be happening, you know, on Saturday and Sunday, and we do have a holiday on Monday, but please know that we are prepared and we will get through them. So thank you.
Thanks for clarifying, Colleen.
Yeah, absolutely.
Elsa had a follow-on question. What about the idea of having an MOU or something with neighboring counties that have better resources so that we have a better safety net when reopening?
So Elsa, there are, all of those things are already in place in the sense of, you know, who we transfer to, what we do, but you have to recognize that we're not, you know, they're going to serve their community, and obviously we'll continue, and we monitor that. Like, you know, as you can imagine, I'm in contact with the hospital. There's a whole system, a statewide system that tells you bed count and what capacity is, and if people, you know, can or can't be transferred there. So that actually already, that happens. That is a natural thing that happens. And so it's not necessarily, but we can't have folks holding beds specifically for Lake County residents. You know, it truly becomes first come, first serve, regardless of where you are, in the state. And even if it's like, even if we're serving, visitors that are coming here, we have to recognize that too, that our regular influx of visitors who come in and get altitude sickness that, requires, some, medical intervention, like definitely, impacts our system as well.
Yeah, just some additional requests to come and observe firsthand, the reality of implementation for the businesses.
No, I think that's definitely our, our hope is, that first week is to kind of, walk around, meet with folks. I think the piece is, I need you to have your staff comply. I need your staff to be wearing face coverings. If the public isn't gonna, step up and do that, and, obviously we don't want that confrontational piece, but let's do our best and let's model the way. Like, I'm more concerned about how you're doing and your staff is working, and I get the public piece, right? There's only so much we can do. We talked about personal responsibility, and we just know in the end that not everyone is going to comply, and we don't want to put anyone, in a position, if you will.
Colleen, this is Kayla. And I'm sorry to jump in, Beth. I've been participating on calls with our regional partners right now, and basically almost weekly. I was in a call last week with each Eagle County, Routt County, Summit County, Pitkin County, and Gunnison County, looking into long-term recovery and where everybody's at with their public health orders. And so I just kind of wanted to provide you all with a little bit of an update of what that looks like in terms of our neighboring communities, with the knowing that Eagle has submitted for a variance. Eagle County is still looking at opening restaurants and bars with a June 1st target date. Same with short-term lodging. Routt County has lodging restrictions through May 31st. Summit County has lodging closed until May 31st with a decision to extend that or open on that date, slated to be made today or tomorrow. Excuse me. There's also a decision to be made on May 21st in Summit County for restaurant opening. Pitkin County is also in that same time frame as us, and Gunnison County has lodging slated to open at 35% on May 28th. So I think having that information out there that, we do see those other counties applying for variances, but the time frame for some of those huge impactful influxes of tourism is very much aligned on like a regional platform. So maybe, Colleen, would it be helpful to talk through kind of what a variance looks like, or what you could apply for a variance for? Because I think that there's maybe a misconception out there that you can apply for a variance and jump from that group of 10 people to completely opening with no restrictions. And I'm sorry if I missed that you had already discussed that, but maybe if you could add some information on there around that.
Yeah, absolutely. I appreciate that, Kayla, and thank you for that info. And I appreciate, like I said, we're all working with our different regional partners, and we all have our different, folks that we meet with. So hearing some more of that, like, I recognize that yes, we are more in alignment than not. And like I said, Eagle definitely feels like the island, if you will. But as far as the variance process, like when I, obviously I've looked through some of the variances that are being applied, like it's not a wide open door. It is a variance, like for restaurants example, which is like opening in this exact same capacity. You still have to have social distancing protocols in place. That's criteria number 5. Like, and you have to show that if you had an increase, you have the ability to kind of diffuse like an outbreak very quickly. And for our county, that's not a big number, right? That's like, we get 4 folks and that's considered an outbreak. And we have to consider like, do we have the resources and what that looks like? Because if you have 4, active cases at the same time, and then we're connecting, the dots to see who else, who's been affected. And I think totally a side note, but if, someone comes down in your facility that is sick and they've been in close contact, with your other staff members, like they need to quarantine for 14 days since onset of that person's symptoms, which means that you might be losing staff as well. Just another little note of like, hey, why it's so important that we continue to, emphasize all those social distancing pieces, but it's not, kind of to Kayla's point, it's not a door wide open. It's basically looking at the current governor's orders, where you think you want some movement. It's not all or nothing. It's not, oh, you don't want to listen to the governor's orders at all. It's basically picking the pieces that you want in your county to open sooner than what the governor is currently slated to do. I think that's kind of the short of it. So, but it's not, yes, disregard all the social distancing. You still have to meet those 5 criteria that we just talked about. Like, those do not go away.
I know we have several people who are just calling in, so I just wanted to remind those that if you want to share a question, you can *6 to unmute yourself. And I'm not seeing any.
Oh, okay. I was going to say, I was just going to touch on one more thing. I think we have to recognize that currently with the governor's orders, as far as us being, more strict, the only difference between our orders and the governor's are our lodging pieces. Otherwise, we're in alignment all the way across.
Not seeing any other questions in the chat. Is there anyone who would like to unmute yourself to share a question? So Sarah Dallas just shared the link for the construction update meetings, which I believe is tomorrow morning. We will also be including that in our weekly community briefing document. So again, if you're not on that distribution list, please email lakecountypio@gmail.com so we can get you added to those updates too. And yeah, the construction meeting is tomorrow, Thursday at 10:30 a.m.
I want to thank everyone who stayed on for the duration. We were only slated for an hour, but obviously we want to make sure that, we had the ability to answer, all the questions. I do have some notes that I will follow up with some folks, offline as I see appropriate. And please feel free, to reach out as well if there's something that you felt that we didn't answer well. And like I said, I genuinely cannot thank you guys enough. And we will do this, and we'll do this well. And we'll be able to keep rolling, if we were able to kind of follow all those pieces of the social distancing and all of our protocols and things. So thanks.
All right, thanks. So not seeing any other questions. I did paste the link to the summary document again in the chat box. So take a look at that and reach out to Environmental Health with any questions or to take action on your individual application. All right, and we will have this video posted later this afternoon. Thanks again, everyone, for your time, and have a good day.
Thank you guys so much.